Well, it's time for Newsdeck. The next 30 minutes we'll be here updating you on what is happening in the world of news. My name is Linda Lela. It's always a pleasure doing this for you, so keep it right here. We have so much in store for you in terms of matters health across the country, matters politics, but to kick us off, we take a look at what is happening right here in the country in regards to the heavy rains that have been pounding across. And now at least 237 Kenyans have so far lost their lives through floods across the country. Now this even as the Meteorological Department warns of more rains in different parts of the country. The weatherman has urged Kenyans to move to safer grounds.
Just to alert Kenyans that the flooding situation in the country continues to worsen as the rains continue. As our experts have projected, these rains will go into June, so they are still here with us the next few weeks, and we are asking Kenyans to be aware that the areas that are close to rivers, the hilly areas that are landslide and mudslide prone, are risky areas to be during this rain season period. As of this morning, Kenyans who have lost their lives due to floods are 237. That is a very high number compared to Kenyans who have lost their lives to COVID-19, who are about 33. During our first briefing, you do recall that the number then was 116. That was on 20th of April. When we did our second briefing, the number had risen from 116 to 164. To the last briefing when we were here, we were at 194. As we speak today, we are 237. Those Kenyans who are affected, in terms of households affected, we did disclose to you in the last briefing, we had 122,000 Kenyans affected. As of this morning, that number has risen significantly to 161,000 households affected, meaning we have almost 807,000 Kenyans who are affected by these floods. And with the rain still going on, our dams still filling, we expect that more will be affected. Therefore, we are here today once again.
Yes, and still on the rains that have hit several parts of the country so hard, we now cross over to Tana Delta, and residents living in flood-hit areas in Tana River County have been urged to move to safer grounds. This after floods left more than 5,000 people homeless in the area. Speaking while assessing the extent of destruction, Coast Regional Commissioner John Elungata said the Coast Guard Service has stepped up surveillance for coronavirus to keep the disease at bay.
Wakaji wa Makere ya Melalulu tulikuwa tumeishi hapa karibu miaka 60 tuko hapa. Na hivi tunavyoona mbele yangu karibu nyumba 30 zimeenda na maji. Ikiwa kuna msikiti, kulikuwa na shule ya watoto wa madarasa hapa, na nyumba za wajamii zimeenda zote. Na tukiangalia pande ile ya ngambo kulikuwa na wakulima walipanda mchele, maharagwe, kunde, mahindi, na yote ilienda na maji.
Kule ambapo kuna mafuriko ndio tunataka tuangalie sana. Nimekubali tutaenda pale county secretary, we'll go and see, because serikali imesema yule mtu anakatalia kwenye mafuriko lazima aondolewe kwa nguvu. Polisi wako hapa, tutaenda tuone kama ni watu ambao lazima tuwatoe leo, tutawatoa ndio waepuke matatizo. Kwanza waepuke kusombwa na maji, alafu pia waepuke corona.
And a 49-year-old man has allegedly beaten his wife to death following a quarrel over a misplaced mobile phone in Sikubale village, Kakamega County. And as Mulindi Kerry now reports, irate in-laws of the accused man raided the home and torched his house and slashed all his crops in retaliation.
This is what is left of Elphas Mianda's home after his in-law torched his house, reducing it to ashes after he allegedly beat his wife to death following a quarrel over his misplaced cell phone.
wakakuja wakafunga mlango, kaanza kumchapia kwa nyumba. Nikaita watu hawakujako.
Ilitokea tu kwa simu. Sasa kwa ile harakati Elfas Mwanda alikuwa na hasira na akaweza kumpiga, na hatukuwa tumetarajia kwamba tunaweza poteza mtu.
Uzozani ilitokana na simu. Wewe ukiwa umelewa unatoka huko unakuja kuambia mama akupee simu. Yeye anajua penye umetoka, umekuwa na simu ukaiweka wapi. Ana uhaki wa kujua simu umeweka wapi.
Mimi kukuja hapa nimepata nyumba zimechomwa. Nimepata vitu kwa boma hakuna. Hata vile nimesimama hivi sijui kama nitakula kwa hii boma ama sitakula. Hakuna chochote kwa hii boma. Na siwezi jua nitaanzia wapi nimalizie wapi.
According to the deceased elder sibling, Jerida Namalwa, this is not the first time Muyanda made threats over the life of his wife. Only this time, he made true his threats.
Ilikuwa kwa mwaka wa 2014. Alikimbia akakuja nyumbani huko ya kwamba amejaribiwa na mzee wake akimwambia atamuoa. Na kweli akakuja paka wazazi wakampeleka hospitali akatibiwa akarudi. Sasa hii imekuwa sasa ni kuwawa kwenye alikuwa anaambiwa.
Angered by the killing, locals have vowed to teach the suspect a lesson that will serve as a warning to wife batterers in the area.
Na hiyo Rikuru kusema sisi tukua wapole hakuna upole. Ukitenda mbaya ni kupigwa. Na hiyo tunahakikisha tutaendelea na hiyo, hata ukue wewe ni Rikuru unafanya mbaya tunadili na wewe.
Mulindi Kerry, TV47 in the county of Kakamega.
Yes, and now to some bit of politics. The rift between President Uhuru Kenyatta and his deputy William Ruto is growing wider every day as allegations of major changes in the cabinet and the National Assembly are expected. This comes few days after the changes in Senate where Kanu's stalwarts took over majority leadership. Let's take a look. Oh yes, we have our reporter Liz Motuku on standby in the other studio to update us more in regards to these political talks that are taking shape right now. Liz, if you can hear me, and we go straight to it. What does this speak? And is it over between President Uhuru Kenyatta and his deputy?
Well, thank you, Linda, having me here afternoon. And it is for now, it is over. That is what I can say according to my thinking and what I've seen. It is more over between President Uhuru Kenyatta and Ruto. With the happenings of yesterday and the day before yesterday, where two people which are major and key in the Senate, that is Murkomen and Kihika, were axed in the changes. And what does this mean? It means that there won't be that close relationship or repairable relationship between President Uhuru Kenyatta and his deputy William Ruto. And allegations today, Linda, has it that these two leaders, apart from these two leaders, there is a secret meeting between President Uhuru Kenyatta and some leaders in the rift, where former Bomet Senator, who is Isaac Ruto, is being brought on board to take some cabinet position or whatever it is, and in this case it won't be easy for Ruto. And let me ask you this, Linda, do you think it is easy for Deputy President in the relationship they have between President Uhuru Kenyatta?
All right. Well, clearly and evidently for some of us, or those of us who've been following up on politics, Liz, it is going to be a bitter end, or better yet, the end is nigh, but pretty much, interesting. I'd want to look at this angle of bringing in some leaders from the rift. Of course, we've talked about Ruto recently, and we also talk about Spogisio himself. I mean, what does it speak when you see the president trying to incorporate leadership or bringing in people from this particular region? I mean, is it a balance that is trying to strike and to equally nurse the ego of the people of that side now that they feel like they are wounded, that their man is being targeted?
Do you think in the next changes, because they're going to happen as soon as the National Assembly is going to resume, there is going to be other meeting, and where the Ruto's men are going to be axed, starting with a few, if I mention some, majority leader in the National Assembly, none other than Aden Duale. Moso is seen like is leaning in the DP side, and not only him, Washiali also is another character who in this case might be affected. And in the cabinet, there are some cabinet secretaries who are more leaned to the DP's side, also might be out, and Kanu's people and all stalwarts will be in, starting with the Isaac Ruto and other leaders from...
All right, Liz, my director is telling me to let go of you, but not before I ask this pertinent question. What does it speak about the aspect of peace? We know very well that President Uhuru Kenyatta is a symbol of peace, constitutionally expected to look into the aspect of unity of the country, which he says is one of the key things that he would want to leave as a legacy. What does it speak right now when we see such rifts?
When the president speaks of peace, and in this case he's speaking more leaders, bringing on board and taking off the leaders who have been with him throughout the election and into his leadership the first term, it won't be any peaceful anymore. I don't think whether there is going to be any peace in matters politics in this country, and more so we're going to expect more politics more than COVID-19 as it is for now.
Well, I wish we could say that at least we have something to celebrate when it comes to matters politics. But of course, from our very own political reporter, that is Liz Mutuku, seems like things are not going to be easy, ahead. But well, we cross fingers and we hope that we get to that bridge and see what will play out. But that aside, now let's come back to the stories that we have. And truck drivers moving goods across East Africa have borne the full brunt of the COVID-19 pandemic, with the bulk of the latest confirmed cases being from and transmitted by truckers. In a virtual East African community heads of state and government meeting that was held on Tuesday, the country acknowledged the need to work together to curb the spread of the virus that has been ravaging the world. Tanzania skipped the meeting for a second time in a row.
The situation at the borders of East Africa community states is dire. The balance between uninterrupted cross-border movement of goods and curbing importation of COVID-19 is delicate. Of the 15 COVID-19 cases confirmed in Kenya Tuesday, one person was a Rwandese national, an example of cross-border coronavirus transmission within East Africa. These are the circumstances that led the heads of state of the East African community to convene a virtual meeting Tuesday morning with COVID-19 top on the agenda.
The measures by the East African community will benefit our entire region.
During the meeting attended by Rwanda President Paul Kagame, South Sudan's Salva Kiir, and Uganda's Yoweri Kaguta Museveni, President Uhuru Kenyatta emphasized on the need for collective EAC interventions against the global COVID-19 pandemic.
At the end of the day, unless we work together, we are not going to be able to solve this problem, because our borders are porous, our people are one, and therefore we must have a common position if we are to actually defeat this virus.
The heads of state tasked their respective state agencies responsible for health, transport and EAC affairs to roll out border screening and testing measures, especially for truck drivers that do not compromise cross-border movement of goods. President Kenyatta highlighted the importance of contact tracing, a method that has successfully been used to track COVID-19 patients.
We are continuing to actively enforce what we call contact tracing, which has actually proved to be very effective, especially in tracing, as President Museveni has said, those who have come into contact and those people they come into contact with. And this has actually helped strengthen our capacity to detect and thereby treat our people.
Conspicuously missing was Tanzanian President John Pombe Magufuli and his Burundi counterpart Pierre Nkurunziza. This is the second time the two are missing the meeting chaired by Rwanda's Paul Kagame. Tracy Mokami, TV47.
Yes, of course, that after being triggered by the clarion calls that indeed East Africa should proceed and take a common approach in dealing with COVID-19. We'll be following up closely on how the events take shape, and we'll be right here to update you on that. It's time that we take a short breather, and we'll be right back with much more news, so don't you go anywhere.
When it comes to pimple care, Acne's Creamy Wash contains multiple vitamins and removes excessive oil and dirt. Acne's Toner rejuvenates skin. Acne's Sealing Gel fights bacteria. Use Mentholatum Acne's for clear and smooth skin every day.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today, Mount Kenya University, unlocking infinite possibilities.
The coronavirus is spreading rapidly across the world, and currently there is no cure or vaccine against it. It spreads through tiny droplets when infected people speak, cough, or sneeze. These droplets can land on surfaces to be picked up by hands and are impossible to see with the naked eye. But just because you can't see them doesn't mean that they are not there. And you may get infected if you touch your face, nose, mouth, or eyes. To help stop the spread of the virus, we all need to do the 5. 1. Follow these steps to wash your hands frequently with soap and water for at least 40 seconds. 2. Cover your mouth with your bent elbow whenever you cough or sneeze. 3. Avoid touching your face. 4. Avoid crowded places. Keep a safe distance from other people. 5. Stay home if you can, especially if you have any of the symptoms. For more information, visit www.who.int.
And thank you for choosing to stay with us. Newsdeck is back, and we have so much more news for you. And we start off with this particular one, where proposals have been coming on board on how best we can deal with COVID-19. And now, Uasin Gishu Governor Jackson Mandago has urged the government to be cautious with vaccines coming from foreign nations, as he urged Kenyan scientists and institutions to develop homegrown solutions to Kenya's challenges. Now, Mandago says the COVID-19 pandemic is among the many health challenges that Kenyan scientists, research institutions and enterprises should develop our own solutions to. The governor said that the ban on travel has compelled Kenya to look inwards for answers, a trend that should continue.
Some countries in Europe and elsewhere think that they can come and use Africans and Kenyans as guinea pigs for their vaccines. We also want to tell them we are sorry. We are not available. Sio ti watu watufanye sisi ndio mahali ya kuja kujaribu kila kitu. Na kama serikali, Ministry of Health, I want to urge you, all vaccines sasa zitakuwa zikuja nchi hii tukague kikamilifu. Afadhali tukuve na njaa kuliko kuja kukuva na vaccines ambazo zinaletwe ambazo zinadhuru afya yetu. And we must be candid. And I must acknowledge the Catholic Church. Whenever there is an issue with vaccines, they are always the first to say. Na kuanzia leo, mimi nikisikia tu vaccine Catholic wamekataa, hata mimi nimekataa. Because it means there is something hidden. Na Waswahili wanasema lisemwalo liko. Kama liko, na pia sisi kama Afrika, can we believe in ourselves? Hata hii madawa ya nyumbani iko sawa. Mimi najua madaktari kina Evelyn hapa wataka kusikia hiyo. Hii watu wamesoma kwa university wataka kusikia dawa ya nyumbani. Dawa ya nyumbani inafanya kazi. What you only need is research.
Well, and as the world marked Nurses International Day yesterday, health workers in Homa Bay are seeking government intervention in their welfare while performing their duties. They are, among other things, demanding for personal protective equipment while handling people with coronavirus disease.
I want to encourage the nurses. I know it is that hard, but because we are professionals, we know how we are supposed to take care of ourselves. We know how to protect ourselves.
I can only appeal to the government that take the welfare of nurses first and you will achieve health. In fact, nurses are with the patients 24 hours.
We decided to celebrate with our children in this hospital. The government came in handy, and where we have reached, we can say a lot of things, good things are going on in order to contain this.
And they work tirelessly in the community, almost unnoticed. In some communities, community health workers are the only health caregivers available for hundreds of people. But even with the humongous work they have to do, many go for months without pay. And now, many do not have the personal protective gear to guard against the highly contagious coronavirus. Here is Daniel Demede with a story on Unsung Healthcare Heroes.
Healthcare providers, community and patients in the country all benefit when community healthcare workers build bridges that lead to better healthcare, better lives and reduce the cost of healthcare in the country. It is at this point these community health workers, or rather CHWs in Kisumu County, popularly known as Nyamrerwa, have volunteered to spearhead better healthcare, create awareness in rural communities and vulnerable people on communicable diseases. We meet Morina Cheng in the morning hours at her home in Nyalenda B slums. At 35 years of age, she is an energetic woman and she is ready to go meet her many clients. She tells us that she normally communicates with her clients via phone, but to those who lack mobile phones, she is always forced to move physically to their households.
Saa tatu kuna clients wangu wengine naweza kuwapigia simu wenye wako nayo. Tuna communicate through simu. Kama kuna umuhimu zaidi, ninafika mahali wako. Na kuna wengine wana simu, lazima nitembee kwa mguu mpaka mahali wako.
Maureen covers a total of 180 households, translating to a population of more than 1,200 people per month.
Mimi nina cover household 180. Total population ni 1,246.
Edward Mito Milambo is another CHW who has been in the field for the last 27 years. His passion toward his work has made him keep on moving and serving his community, making him trusted worker by his patients and health officers.
Hii kazi nilianza kitambo kidogo, mimi nilikuwa mskauti. Hii kitu imestick ni kama ni a call kwa maishani yangu.
Both Maureen and Edward confirm that in their line of duty, things have not been easy. They are forced to dig deeper in their pockets to get facilitation to move around. Further, they say that they lack personal protective gears when interacting with clients, especially during this coronavirus pandemic period.
Kuenda kwa mgonjwa, sina pesa, sina hela, nitatembea.
Sisi kama CHV wa Kisumu County, hatujakuwa kwa payroll for so long. Hadi hivi majuzi last year vile UHC ilikuja, UHC ndilianza kutulipa shilingi 3,000 na wanakata 500 inaenda kwa NHIF. Na sofa hiyo pesa hatujapewa kwa miezi 8 hadi wa leo.
Na hii mambo ya COVID-19, mtu lazima kwae kwa nyumba. Sasa hii tunapata very big challenge, tunakaa kwa nyumba.
Despite being volunteers in the community, still some leaders keep them at bay.
With the community there's no problem. Shida iko tu kwa county government na government, national government.
Serikali so far naweza kusema imetutupa kiasi.
On the other hand, clients of community health workers have applauded their efforts.
Watuongezewe Nyamrerwa zingine ili watusaidie.
Na muhimu sababu anatusaidia. Hata ukitaka dawa unaweza muende umuulize hivi na hivi kusaidia.
Community health work alikuwa ananitembelea, ananisaidia, ananipea mafunzo. Ananiambia mtoto nanyonyesha paka 6 weeks ndio nampatia chochote, maziwa kaa uji hivyo. Naona kama amenisaidia sana.
Kisumu Governor Professor Peter Anyang' Nyong'o has said that currently the county has 2,558 CHWs and the optimum number is expected to be at least 5,000.
But at the moment we have 2,558 community health workers in Kisumu County. Optimally, we really need about 5,500.
The governor says that the county has come up with a plan to ensure every CHW receive his or her own salary. Professor Nyong'o regrets that there have been instances where mismanagement of funds belonging to the CHWs has led to delay their pay.
We cannot have more CHWs than Kakamega. Kakamega have 12 constituencies, we only have 7. So there's no way that we can have more CHWs than Kakamega. There must be something wrong somewhere. So we agreed here that I won't pay them quarterly. The money is now there in the budget. We are going to pay in arrears those months that have not been paid. And we agreed we are going to pay them in arrears, which is going to be a bonanza for them.
Daniel Dembede, TV47, Kisumu County.
Yes, and as we proceed, we also cross over borders to just take a look at what is happening, especially right now with the COVID-19 crisis and, the closing down of borders, from different quarters, especially within the East African community. We seek to understand what the processes are down there, and we get to know whether indeed the truck drivers are having it smooth. And that's exactly what we'll be going through right now, as truck drivers moving goods across East Africa have had to bear the full brunt of the COVID-19 pandemic, with the bulk of the latest confirmed cases being from these areas, of course, are transmitted from the truckers themselves. In a virtual East African community heads of state, we had, of course, the government meeting held on Tuesday, and the countries acknowledged the need to work together to curb the spread of the virus that has been ravaging the world. Indeed, Tanzania skipped the meeting for a second time in a row. And as we had seen that particular story, it's now time that we cross over to Rwanda. Our reporter Diana Iriza is on standby to update us on the situation down there and how this information has been received. Diana, if you can hear me. Diana? Can you hear me, Diana? Diana, yes, of course, we'd gladly need to know how Rwandese or the people of Rwanda are receiving this information, especially right now that there's been that push, that there's a need as Africans.
It is nice talking to you today. Now, the East African community held a virtual meeting yesterday, chaired by President Paul Kagame. But it was noticed that two countries were missing in this meeting. I mean, the leaders of these two countries were missing in this meeting, and that is leaders from Burundi and Tanzania. It is not clear yet on why these leaders were missing in this meeting, but what is clear is that this meeting was held to discuss on the pressing issues that are being caused by the COVID-19 pandemic. Now, if you look at a country like Tanzania, there's a lot. The cases of COVID-19 are really high currently, and the cases that have been currently registered here in Rwanda, most of them come from the truck drivers that are Tanzanians. And Rwanda so far has been carrying out so many measures, including sanitizing trucks and also changing drivers. There's this new system whereby a truck driver from Tanzania comes to Rwanda, and at the border another driver takes over and transports the driver to Kigali city and other provinces of the country. Now, this type of system has caused a lot of misunderstandings between Tanzania and Rwanda, so there's a huge assumption that this is one of the reasons as to why the Tanzania did not participate in this meeting. Plus, also there are also cases in regards to harassment of truck drivers in Tanzania. This could also be one of the reasons as to why the Tanzanian leader did not participate in this meeting. And also, if you look at Tanzania as a country itself, it has been really slow in terms of fighting the pandemic. Their pace is really slow, basically. So that's one of the main reasons as to why Tanzania did not participate in this meeting. If you look at Burundi is known to not really participate in regional meetings and regional discussions and issues that concern the region. And currently it's undergoing elections, so We're assuming that's also one of the reasons as to why Burundi did not participate. But all in all, these countries need to come together. As President Kagame mentioned in the meeting, the countries that were in the meeting cannot do this by themselves. All the countries did need to be part of the discussions and part of the fight of against the pandemic, because there needs to be cross-border trade and cross-border transportation of passengers, and without discussions and collaboration, this cannot happen. And lastly, one thing I'd like to mention, during the meeting, the president did not just talk about the effects of the pandemic. He also talked about the impacts after the pandemic has been combated. How will this affect the East African countries socially and economically? So this was one of the things that were highly discussed, and it was very unfortunate that these two countries were missing in the meetings. But hopefully in the next meeting chaired by the President Kagame, if there's one that will be held again, we hope to see leaders from these two countries participate. Back to you.
All right. Thank you so much, Diana Iriza, all the way from Rwanda. Of course, lots of proposals coming on board as from that meeting, and we can certainly hope that they can be put to practice so we are able to address this as a region. I mean, if we go back to, what has been happening, you know very well that fingers have been pointed at the African Union, the regional bodies, and how best they have dealt with the issues of Africa, not just the COVID-19, but numerous cases looking at, instability, even in the youngest nation. And of course, the question then would be, why is it that we've not been able to deal with our issues as Africans, to perfection, finding homegrown solutions to the issues that bedevil us? We can only hope that indeed with time, this will be addressed. And that very note is where we're going to end up the bulletin. I must say thank you so much for keeping me company, right from the start and up until now. I'll say kwaheri. You can get more news on a subsequent bulletin. It was great having you right here on News Deck. My name is Linda Alela. Do enjoy the rest of your viewing.
The following program is rated PG. It may contain scenes and